How do visible and occult rectal bleeding symptoms compare? Imagine noticing blood on your toilet paper after a bowel movement or seeing streaks of bright red blood in your stool. That's what we call visible rectal bleeding. It's blood you can see clearly, and it often appears as bright red streaks or sometimes darker, tar-like stool if the bleeding is higher up in the digestive tract. Bright red blood usually signals bleeding from the lower part of your gastrointestinal system, like the rectum or anus. Darker stool suggests the blood has been partially digested, which can mean the bleeding is coming from higher in the digestive tract. On the other hand, occult rectal bleeding is a different story. It's bleeding that you can't see with your eyes. The blood is so tiny that it mixes with your stool and doesn't change its color or appearance. This kind of bleeding is usually only found through special lab tests, like a fecal occult blood test. Often, people with occult bleeding don't notice any symptoms at all. It's usually discovered during routine screenings or when doctors are checking for anemia caused by blood loss. So how do they compare? Detection is the first big difference. Visible bleeding is obvious because you see it, while occult bleeding requires lab tests to find. Symptoms can also differ. Visible bleeding might come with other signs like changes in bowel habits, abdominal pain, or stool that looks different. Occult bleeding often has no symptoms and is only identified through testing. Both types can come from benign causes like hemorrhoids or polyps, but occult bleeding is especially important because it can be an early warning sign of serious conditions like colon polyps or even colon cancer. These early signs might not cause any visible bleeding yet but can still be dangerous if left unnoticed. In terms of health implications, occult bleeding is a key part of colorectal cancer screening because it can catch early disease before symptoms develop. Visible bleeding, while more noticeable, can sometimes indicate more advanced or urgent issues that need prompt attention. When doctors evaluate bleeding, visible bleeding often leads to direct examination with procedures like endoscopy to find the source. For occult bleeding, tests like stool analysis, blood tests for anemia, or imaging studies are used to investigate further. Understanding the difference between these two types of rectal bleeding is vital for maintaining colon health. If you notice any bleeding, whether visible or not, it's important to see a healthcare professional. They can help determine the cause and recommend the right tests or treatments. Remember, early detection can make a big difference in outcomes, especially when it comes to colorectal health. Always seek personalized medical advice if you experience any bleeding, and don't ignore these signs.